Well, although it is beautiful weather we are experiencing here in Albany, the occasion that brings folks here to the Capitol, to be quite frank, should not be happening. We know that this program provides essential care to our most vulnerable New Yorkers. And so, as a member of our Senate Health Committee, our chair of our Women's Issues Committee, but most of all, as a concerned community member, as someone who has had to utilize this program for a loved one of my own, most certainly having family members that are home care providers, that are personal care assistants, we as a state have an obligation to ensure that everyone in our state has equitable access to quality, affordable health care. In my district, in Senate District 52, I have several independent living centers that for the last decade plus have been providing such great care. And unfortunately, they are being lumped in with the bad actors that has been used as a determining factor, when the reality is this program has saved and continues to save many people's lives. I want to thank Senator Rivera, Assemblymember Paul, and all of my colleagues in both houses, and I stand with all of you in urging for reform to this program to ensure that everyone that is in need of care, that our workers who are providing these essential services, they do it because they care. These are family members, friends, other community members that have decided to dedicate their time, their talent, their treasure to help our most vulnerable. And as a state, we have not only a policy obligation, we have a moral obligation to provide access to this quality program, and we can and we need to do better. So I stand strongly with all of you in continuing to push for the changes with respect to the bills that have been proposed for this program. No worker who is a part of this program should have to wonder where their paycheck is coming from because PPL has a system error with regards to how they process payments.
That ain't right.
That is not right.
That ain't right.
Nor should individuals who need this program have to be in limbo and wondering if they'll have their care tomorrow because their provider can no longer provide the support for them.
Tell the truth.
It also is not right that benefits that are proposed with this PPL program revision aren't in fact comprehensive for those who are most vulnerable. We as a state have continued to make strides in the right direction, the equitable direction, to provide coverage for all New Yorkers. This is an opportunity to continue in that forward movement so that everyone can thrive and have a brighter future. So I want to thank you all for coming here. Please continue to advocate, and I look forward to us coming to a resolution that ultimately will benefit workers and most of all, consumers of this program. Thank you.